to our small group project 3, the Physical Therapy Public Health Initiative, A Walk to Remember, by Branson Ball, Anna Glidewell, Ashley Porter, and Jeremy Potter. So some background information. The population we're addressing here with our initiative would be dementia and Alzheimer's patients. As you can see, in 2017, over 5.3 million Americans suffered from Alzheimer's disease. So there's a pretty nice prevalence there in America, and the disease itself causes a decline in cognitive and motor function, and this decline can place a very big, very intense care that is needed for these patients as they progress. And so addressing the dementia would be a priority of our public health because not only of the cognitive and motor impacts that it has, but also the severe social and financial impact. And it's not just happening in America. I mean, globally, Alzheimer's is the 5th leading cause of death. And the last part is this population is a burden on not only America but the world, but there's no specific preventative interventions for this disease. There's recommendations, but not community-based programs. So our proposition would be to implement a buddy walking program, and it would be called A Walk to Remember, which would be for all the Nicholas Spark fans, a nice little play on words there. But it would be it would implement aerobic exercise for dementia and Alzheimer's patients, and it'd be low cost, low risk, and widely available because it's walking, and that's easily reproduced and easily done, and regarded sometimes as the best exercise you can do. So, and also research suggests that physical activity also positively impacts the brain and can reduce some of the neuropathological burdens, as well as improve aerobic capacity and potentially even slow the progression of dementia. So that's where our initiative really aims to hit, is kind of using walking to help decrease some of these burdens. So if you're going to do something, you need a what and a why, and the why to this would be the evidence that we found. So aerobic exercise was shown to be effective in preventing and slowing cognitive and motor decline in dementia patients, according to a 2015 and 2017 article. Furthermore, a 2018 article found that social engagement has protective effects against dementia, and that poor social support and poor social network have shown to be risk factors for the dementia, and that is according to a 2018 article. Those articles will be referenced later for your viewing. But this research definitely shows and kind of encapsulates what we wish to provide in this public health initiative of using exercise and socialization to help those. So the what, when, who, where, and why. Well, the who is Alzheimer's dementia patients. The what is the Walking Buddy program. But how often it will occur? We would shoot for 2 times a week to really maximize that aerobic exercise, but as we know, it's exercise is dose dependent, so anything's better than nothing, but 2 times per week would be what we would shoot for. Getting volunteers would be a very important thing. If you're going to have a buddy program, then you need people walking with them. And we can reach out to nursing students, pre-physical therapy students, pre-occupational therapy students, physical therapists, PTAs, nurses, occupational therapists, family members, and really people that just want to get out and help the community. And it would occur at local parks, neighborhood sidewalks, maybe even a high school track. So some health determinants and disparities that affect the dementia population. You have social environment, individual behavior, income, genetics, physical environment, socioeconomic status. And while we couldn't make an impact on all these things because we can't impact somebody's genetics, but we could help them with individual behavior and changing that, or their social environment and really helping them come together, would be the main things we would do. And we would do this by preventing decline in mobility, by strengthening, and by kind of preventing some of the sedentary side effects. And also we would look at the aspects of mental health and with the socialization, because this disease is not only a physical burden, but it also is a cognitive burden as well to those who have it. So along with more disparities, the Alzheimer's Association actually says that eliminating disparities for this population is an integral part of public health. And so that's where we really wanted to take hold and plan our program in. And furthermore, resources should be focused on the underserved, vulnerable populations, or the ones who suffer a disproportionate amount of this disease. And PTs could really help this by implementing dementia-specific strategies that are culturally, linguistically, and age-appropriate. For those who have dementia, those are at risk for dementia and Alzheimer's, and their caregivers, because the caregivers are they play such a vital role in the patient's lives. And this is what our program offers, is really helping to take hold of this disparity seen in public health. So current programs being done, there's a Walk to End Alzheimer's that is done, where people walk in honor of family members or friends, and they donate money for Alzheimer's to the Alzheimer's Foundation to find a cure. And it's done in a big city about once a year, maybe once or twice. But other than that, there's nothing else that we could find that's similar to what we are suggesting. And there are barriers to our program, and that's such things such as transportation. How are we going to get people that can't drive there? Or how are we going to get them all the way across town? Another barrier would be finding the appropriate walking environment. Is the environment nice, level, flat terrain? Because that's what we would ideally want for the safety of these patients, and also where you're at. I mean, in Chattanooga, you're going to have a lot more walkable areas than you would if you were in Dayton, Tennessee. And then also train volunteers, because you are dealing with a population that has cognitive and mental aspects and physical, impairments as well. So having volunteers that are trained and knowing what to do would be very important. So physical therapists could help by screening patients for fall risk and educating on it. They could help by educating on the benefits of activity, and also what other things might benefit this population, such as nutrition. PTs could also provide support to caregivers and family members, because there's a psychological and social burden to them. PTs could use outcome measures to help track progress and provide data, and they could just give recommendations to help the daily lives and make some things easier for these patients and populations. So furthermore, the role of a physical therapist would rely on three major things: advocacy, education, and volunteer training. Patients would be an advocate for the population, because people with Alzheimer's might not have the intellectual capacity to speak out, or the means or the voice in the community. They'd be big on education, and just educating the families on fall prevention, because that's the main thing that, because of the negative association with falls and outcomes, and also just the benefits of aerobic exercise. So education would be huge. And then also training volunteers, because volunteers need to know what to do if somebody begins to lose their balance or falls, or they have a mood swing and they begin agitated. And physical therapists could really help make a difference here in training with these volunteers. So they would also be educating the community, not only just the caregivers and the affected population, but also the community, on the benefits of exercise, on how the improved quality of life of socialization and mood and behavior, and really just helping the overall health, especially in susceptible populations to this disease, would be huge. So community education would be an integral part of this initiative. So there would be goal setting and monitoring outcomes, which we'd want to do, looking at improvements in walking speed, distance before fatigue. We could use a 6-minute walk test maybe. And then also things like aerobic capacity and how we could find that. There's many different formulas. And then just looking at, maintained or improved functional independence at home, whether or not it's by a patient because they're not a reliable historian, or maybe getting their caregiver to tell us more, and seeing how our initiative is making a difference in these people's lives. So some of the outcome assessments we would use would be the geriatric depression scale. Because this is a mental and physical disease, we would definitely want to look at that. And depression is so often a comorbidity with this. So using that to really screen and see if we make a difference, or if there might even need to be referrals made, or different things there. MoCA to help maybe categorize patients on maybe the less trained volunteers go with the more higher functioning ones, and PTs and PTAs that are more well trained go with the lower functioning patients and participants that would be there. 5 times sit to stand to screen for fall risk and see what their lower extremity power is, or a walk test to determine a walking speed because its association with a fall risk. And the big thing would be building social support through positive social interactions in new environments. It also helped build rapport with the facilities, caregivers, and the families of participants, and help support the community through volunteer and bringing that sense of community together. And a big thing we wanted to point out here was that, like, if you look down in the bottom left, you see that 72% of caregivers say their health has worsened. 59 experience depression and anxiety. 32 missed doctor's appointments, and 15 are even hospitalized in this study. And the caregiver plays such a vital role, especially as dementia and Alzheimer's patients progress through their stages, that providing social support for them would be almost just as necessary as providing social support for the affected population by dementia and Alzheimer's. And so by doing this in our program and helping caregivers to find support with others, it could almost, in lack of a better term, kill two birds with one stone and really make a difference on a community and as a whole. So to prevent relapse, we would create that sense of community, between everybody. When you're a part of something, you want to be there. Create obtainable goals that these people could do because, make them more engaged. Create incentives and awards. Whoever shows up has the most attendance in a month could get an award, or whoever improves the most in their gait speed. And maybe we could even reach out to local communities and businesses to provide those incentives and really get the community involved, and just continue to keep that community reach out to attract participants and volunteers. We want to thank you for the time that you took to listen to this. A Walk to Remember is our public health initiative, and here are references that was used. Thank you so much for your time.